I'm Maureen Maguire. I'm a biostatistician in the Department of Ophthalmology at the University of Pennsylvania. I organize and design, analyze multi-center clinical trials, multi-center clinical research in other areas as well. Age-related macular degeneration is a disease that affects the retina, the part of your eye that is responsible for seeing. It starts off in a very early stage as drusen or small yellow deposits, which usually don't have any impact on vision, but many people progress to the later advanced forms, which include a neovascular form, or wet AMD. Wet AMD affects about 1.6 million people in the United States. Our objective was to study two drugs that are available for the treatment of wet AMD. One drug, Lucentis, had been proven in clinical trials to be extraordinarily effective in the treatment of wet AMD. A second drug, Avastin, had not been tested in clinical trials but was being widely used by ophthalmologists for the treatment of wet AMD. And we wanted to find out if Avastin was indeed as good as Lucentis. We studied patients who had wet AMD. Most of those patients, the average age is about 80, so these are older folks. The results of this study tell us that Lucentis and Avastin provide very similar results at 1 year on vision. And that's a very important finding. The results also tell us that when we treat only when there are signs of active neovascularization, we get very similar results. The important thing to know for all patients is that with either one of these drugs, we get very good results. Patients see at 1 year as well as or better than they did when they walked in. Just 10 years ago, when a patient walked in to a doctor's office with wet AMD, they could expect to almost certainly lose not 1 letter, but 15 or 20 letters on the eye chart. So we've gone from having patients facing a lot of disability because of their vision to a case where they need to have multiple treatments, but they preserve their vision. Macular degeneration is a chronic disease, and we will need to know how these patients do beyond 1 year. We will be following our study patients to see how their visual acuity maintains over the next year, and the types of anatomical changes that might occur, as well as the adverse events that might be associated with each of the drugs.